This is Chris in Geneva with a very quick audio test for Dr. Nono. Do you hear me, Dr.? Oh. Hello there. Thanks. So glad you could join us.
Thank you.
The sound is okay?
Hey? Yes, it is. Thank you.
Excellent. Thank you so much for joining. Nice to see
Thank
you.
you. Thanks, Chris.
We miss you here.
Hello to you wherever you're listening today on Tuesday, March 9th, 2021. My name is Carla Drysdale, and I'd like to welcome you to today's virtual press conference based at the World Health Organization headquarters in Geneva to launch the biggest ever global study of the prevalence of violence against women. The report contains global, regional, and national estimates for intimate partner violence against women, and global and regional estimates for non-partner sexual violence against women. This press conference is in English only today, with no simultaneous interpretation. Present in the room today here in Geneva at headquarters are Dr. Tedros Adhanom Ghebreyesus, WHO's Director General, Dr. Princess Nothemba Simalela, Assistant Director General, Strategic Programmatic Priorities and Special Advisor to the Director General, will actually be joining us online today. In the room here, we have Dr. Claudia Garcia Moreno, Unit Head, addressing the needs of vulnerable populations, WHO's Department of Sexual and Reproductive Health and Research, and the UNHRP, as well as Dr. Lynn-Marie Sardinia, Technical Officer for Violence Against Women Data and Research, working in the same WHO unit as Claudia. Our online guests are Phumzile Mlambo Nguka, UN Women Executive Director, and Wendy Morton, MP, Minister for the European Neighbourhood and the Americas at the UK's Foreign, Commonwealth and Development Office. And I've already mentioned Dr. Princess Nothemba Simelela, who is also online with us today. And with that introduction, let me now give the floor over to Dr. Tedros for his welcoming remarks.
Thank you so much indeed. Dear Phumzile, the Executive Director of UN Women, Wendy Morton, Minister of for the European Neighbourhood and the Americas at the United Kingdom's Foreign, Commonwealth and Development Office, my WHO colleagues, Dr. Claudia and Lynn Mary Sardina, dear colleagues and friends, good morning, good afternoon, and good evening. And thank you for joining us for the launch of this very important report. As you know, yesterday was International Women's Day. At our regular press briefing, we celebrated the incredible contribution that so many women are making to the fight against COVID-19 in so many ways. But we also noted that one of the consequences of the social restrictions put in place to suppress transmission of COVID-19 has been an increase in violence against women. Today, WHO is launching a new report that represents the largest study ever conducted on the prevalence of violence against women. I would like to thank UN Women for their partnership through our joint program to improve data globally on violence against women, and I would also like to thank the United Kingdom for the funding it provides for this work. The report includes data from 158 countries on intimate partner violence and sexual violence by a non-partner for women and girls aged 15 years and older. The results paint a horrifying picture. An estimated 736 million women, almost 1 in 3 women globally, have suffered intimate partner violence, sexual violence from a non-partner, or both at least once in their lives. And almost 1 in 4 adolescent girls in a partnership have experienced physical and/or sexual violence from a partner or husband before their 19th birthday. Globally, women in lower middle income countries suffer disproportionately from violence, especially in Oceania, Sub-Saharan Africa, and South Asia. Violence against women is not just criminal. It has long-lasting implications for the physical, mental, sexual, and reproductive health of women. Injuries, depression, anxiety, unplanned pregnancies, and sexually transmitted infections, including HIV, are just some of the health issues that survivors of violence must live with. The harm done to individual women is bad enough, but the impacts go further, tearing the very fabric of families, communities, economies, and nations. We all lose. This is an old problem, but we can change it. We know what works. We can prevent violence with legal tools by reforming discriminatory laws. We can prevent it with economic tools by strengthening women's economic rights and wages. We can prevent it with educational tools through school programs that challenge gender stereotypes, promote healthy relationships, and provide comprehensive sexuality education. We can prevent it with social tools by challenging social norms that support harmful views of masculinity and condone violence against women. And we can use clinical tools to provide quality care and support for women affected by violence. But the most powerful tool we have is ourselves. all of us can make a difference, women and men. We can all speak up to say that violence against women is never acceptable. We can all teach our kids that violence against women is never acceptable. And we can all treat the women in our lives with the respect and dignity they deserve, and that all people deserve. I thank you. And back to you.
Thank you very much, Dr. Tedros, for those remarks. I'd like to turn the floor over now to Phumzile Rambo Nguka, Executive Director of UN Women. Go ahead, madam. The floor is yours.
Thank you very much. Thank you, Tedros, for those powerful remarks and introduction. MP Wendy, Dr. Nono, dear Claudia, thank you so much for this very important work. Violence against women is the most widespread and persisting human rights violation that is not prosecuted, that is also common in every part of the world. We know that from this report and other experiences that we have from our work, that the gender power imbalances play a key role in making this type of violence to survive. We are particularly concerned about the fact that domestic violence has been so entrenched because home is the one place that a woman can find shelter and peace, supposedly. But as we can see, it is not so. And of course, violence against women comes at a high cost to the family, the mental health of the family, the economic health of the family. We know that the cost of violence against women impacts on women's earnings as well as the economies of countries. During COVID, we saw how violence against women increased as women were trapped in the same homes as their abusers. And we want to call on the governments to continue the interventions that were started during the time of COVID in the countries where those occurred, which made it possible for the services critically needed by women who were facing violence to be declared essential services and to be funded in an increased manner. We also had 155 countries. We have rather 155 countries who have now passed laws that are related to domestic violence. We continue to push ahead with that work. It's part of the work that we do in UN Women, supporting member states who are passing these laws. And 140 have legislation also on sexual harassment in the workplace. But of course, the challenge of enforcement still remains. And that is where we can all also play a role in supporting the enforcement. We know that in the time of Corona, when countries were focused on the challenge of conquering the pandemic, in some cases, shelters that women need were given over as places for isolation. We have urged that governments made adequate means for women and not sacrifice them in the fights against the pandemic. Ourselves and WHO are partners in generation equality, which has member states, young people, private sector, individuals, and we are both responsible in the Generation Equality Action Coalition on ending violence against women. This report will be very important for this action coalition. The UK and Kenya are amongst the two governments that are leading in that action coalition. And I think we all will truly appreciate this study and will use it so that we can do evidence-based work. We are also thankful to the Secretary General for the role he has played in raising his voice and highlighting the prevalence of violence against women in the world. And that has elicited some response amongst member states. But again, we need to see real implementation and sustained interventions in response to the Secretary General's report, as well as hopefully in response to this report, we will see more countries taking decisive steps. Once again, thank you very much. Thank you, Claudia, for this excellent work. Over.
And thank you so much for those remarks, Phumzile. We'll now hear from Claudia Garcia Moreno of the WHO, who will give an overview of the key findings of this report.
Interest in this very important and sadly very persistent problem that affects so many lives globally. Behind these numbers are women, our families, our human suffering, a lot of human suffering. The report, as has been mentioned, is based on a very comprehensive and systematic review of all available data on the prevalence of these two forms of violence collected between 2000 and 2018. That was either publicly available or was made available to us by countries. And these are the first internationally comparable estimates during the Sustainable Development Goals reporting period. We believe they provide us with a robust baseline against which we can track progress as we move forward. The numbers are stark, and we have already heard some of the headline. I will repeat first the combined estimate for the two forms of violence that we are measuring, physical and or sexual violence in the hands of a partner or sexual violence in the hands of non-partner, remains stubbornly around the 1 in 3, 30% of women 15 years and older. The vast majority of this violence is violence by a former or current husband or intimate partner. Over 1/4 of women who have ever been partnered over the age of 15, 26% have been subjected to either physical or sexual violence by a partner at least once of their lives. And as we've heard, sadly, this violence starts early, affecting already 1 in 4 adolescent girls and young women. When we look at current or recent violence, which is measured by asking in surveys about whether this happened to you in the past 12 months, we find that 16% of young women between the ages of 15 and 24 have experienced current or recent violence, so violence in the past 12 months. Globally, 1 in 7 women are experiencing violence recently or currently, 13%. But this global figure hides very stark differences between high-income countries and low and middle-income countries, where women often have limited access to the economic and the social support that they need to leave abusive relationships. The prevalence of violence, intimate partner violence, is unacceptably high everywhere. But as you will have seen and as has been noticed, there are important differences across regions and across countries. And we have around more than 30 countries where the lifetime experience of this violence is higher than the global average. It can reach higher than 30% and even as high as 52%. That means 1 out of every other woman is experiencing abusive relationships. So while intimate partner violence remains the most prevalent form of violence against women globally, also we documented that 6% of women and girls globally have been subjected to sexual violence by someone other than their husband or partner. The true prevalence of sexual violence is likely to be much higher. while we have seen more women disclosing thanks to movements like Me Too or Stop the Blame and others, the issue remains highly stigmatized, and many still fear the blame and the repercussions if they speak out. I know that this report presents a very bleak picture, and that the numbers are very shocking, even for those of us who, in a way, are not surprised by them, but are still shocked by them. But I also do want to highlight that there is progress. Firstly, we have almost double the number of countries than we had in our previous estimates that were published in 2013 that have at least one survey in the last 18 years measuring this form of violence. And while the data is not perfect and there is room for improvement, naming and counting the problem is often a first step for action and for dialogue at both the policy level and in society with the general public. Secondly, and has already been mentioned by Phumzile, we have around 155 countries that now have laws on domestic violence. We want to see them fully enacted. Thirdly, we know much more about how to prevent violence against women than we did even 5 years ago. And a call out to a UK government-supported initiative called What Works to Prevent Violence Against Women and Girls that in the past 5 years has supported research and rigorous evaluation of more than 18 interventions in different countries. So we now have a menu of interventions that we know are promising or effective in reducing particularly intimate partner violence, not in decades, but within years. And we need to really expand these and scale them up. Some have already been mentioned, school-based programs, community mobilization programs around changing gender norms, and particularly changing norms around the acceptability of this violence, cash transfers that were not designed or intended for reducing violence against women have been shown to have an impact in reductions of violence, psychological interventions to support survivors. So we have a much bigger understanding of both what works to prevent and what do we need to do in terms of services. And we need to work hand in tandem in both prevention and ensuring that those who are already suffering these situations have access to survivor-centered services and comprehensive services, and that we have a joined-up, multi-sectoral, coordinated response. Specifically in relation to the health sector, countries in all regions have been adapting WHO guidance and tools for strengthening the health system's response. And even in high prevalence countries like Afghanistan or the Democratic Republic of Congo, we are working closely with the ministries of health to develop national protocols. Thousands of healthcare providers have been trained. And clearly this is not enough and needs to go hand in hand with changing norms. At the same time, health services are often a safe place for women to go to and can be an entry point for other sources of support. In other countries, we have been able to integrate the response to violence against women into UHC packages. So to conclude, we have a glass half full, glass half empty situation. We have come a long way. Clearly, we still have a much longer way to go. There is a lot more awareness and recognition of the problem, and also more knowledge and evidence around solutions. We really hope that these numbers will shock us all, governments and other actors, and as the DG said, all of us, because we can all play a role, into acting with more urgency, into reaching those commitments that we have already made in our different capacities, and really accelerating action to be able to get close to achieving the Sustainable Development Goals, particularly around the elimination of all forms of violence against women and girls. Thank you.
Thank you so much, Claudia, for those remarks. I'd like to turn the floor over now to MP Wendy Morton from the United Kingdom. And please note that Ms. Morton will need to leave the press conference after her remarks. Over to you, Ms. Morton. You have the floor.
Thank you. Thank you so much. I'm pleased to be able to be with you here today to draw much needed attention to the powerful findings from this new report, which provides yet further evidence that violence against women and girls remains one of the most widespread human rights violations of our time. I'd like to thank the World Health Organization and UN Women for their leadership in generating this rigorous data as a global public good. It reveals the persistent magnitude of violence against women around the world. I've been deeply concerned by the surge in violence during the pandemic, including here in the UK. But as we have heard, even before COVID-19, violence was at epic levels. We know there is a risk that once the media spotlight moves on from COVID-19, some will wrongly assume that the violence has suddenly stopped. It's therefore vital that together we sustain a long-term approach to stop violence before it starts. Despite the scale of the problem, we now have rigorous evidence to show that we can prevent this violence, and it does not have to take generations. The UK-funded What Works to Prevent Violence programme has shown that interventions tackling values and behaviours at homes, schools and communities can achieve significant reductions in violence of around 50% in a few years. Building on this success, this year the UK will be launching the first ever global effort to increase implementation of proven violence prevention approaches through our What Works to Prevent Violence Impact at Scale global programme. I feel proud to be part of a government that is recognised for its global leadership on violence against women and girls. But I'm not complacent. We have a long way to go to tackle this abuse, and the UK remains steadfastly committed to working with the WHO and UN Women to eliminate violence against women and girls. That is why the UK is co-leading the new Generation Equality Global Action Coalition on gender-based violence, along with other fantastic partners. We're using this platform to drive more concerted, coordinated and scaled up global action to address violence, sharing our evidence from what works to encourage a data and evidence-based approach. As we've already heard, the new data has reinforced the reality that adolescent girls are particularly vulnerable to higher levels and multiple forms of violence. Tackling this will be a focus of the Action Coalition. Together, we must get to the root of the issues. We have to change the way that society values women and girls, ensure they have access to quality education, health services and opportunities, and make sure that their rights are respected and realised. It's a hard task, but we know it is possible. The shocking estimates released today must serve as a further call to action for us all. But we will not be deterred by the scale of the problem. We now have the evidence that violence is preventable, and we know what approaches are effective. Together, we have the opportunity and the responsibility to translate this evidence into long-term prevention. And I'm resolutely determined that the UK will continue to play its part with others in driving down rates of violence against women and girls so that no woman has to live in fear of violence, and so every girl grows up knowing she is safe. Thank you.
And thank you, Ms. Morton, and to Claudia Pumzili and Dr. Tedros for all of your remarks addressing violence against women. So let's now transition to questions from the media. For journalists who wish to pose a question, can I ask you to please use the raise the hand icon on your screen, and remember to unmute yourself. And please stick to one question, and let's get started. I'd like to first call on, Paula Dubias from the New Humanitarian in Geneva. Paula, are you online? Could you unmute yourself and go ahead, please?
Yes, thank you for taking my question. I had a question about the data collection. in Latin America, to take one example, there's there's serious issues about the collection of data, which is very often uneven or inexistent. There are no registries. Of course, as we know, there are already issues with people coming forward to report their violence. And I'm just wondering if this doesn't send a wrong message to countries that perhaps they may not be doing as badly as the report says. Also, there was a report last week by CARE that said that the UN agencies are not doing enough to ensure the safety of women and girls, and that there are a lot of proclamations about having to move forward, but that in essence there's not enough real action that's being done by the agencies.
Thanks very much, Paula. I think we'll have Claudia address your question.
These estimates are based on data that comes from surveys or studies conducted in countries, and that were either publicly available or were made available to us by countries. And the estimates that we have at the moment, we think, are fairly robust, and they're as robust as we can have them with the current existing data. There are, of course, many opportunities to improve the data collection, as you rightly point out. And this is precisely one of the purposes of the joint UN Women and WHO program. It has a component of capacity building, which is being led by UN Women, and we have had a couple of regional workshops already. And one of the interesting outcomes of the country consultation has been this interaction with national statistics offices or health departments or whoever is responsible for collecting this data, to think of how we can strengthen data collection and how we can strengthen data, administrative data from police or health or other services. So there are challenges with the data, and it is one of the elements that we will continue to work on, is to build capacity and to strengthen the measurement and the collection of this data.
Thanks very much, Claudia. Next on the list, we have Sophie Mckenna from SABC. Can you hear me, Sophie?
Yes, I can hear you loud and clear. I just want to find out from the UN UN Women Executive Director, Dr. Phumzile Mlambo-Ngcuka. Dr. Phumzile Mlambo-Ngcuka, you did launch a campaign, He for She, where you encouraged heads of state and government to support the campaign in a fight against this pandemic some years ago. How far are you in terms of the support from the heads of state and the commitment from political leadership to deal with this pandemic?
Phumzile, would you like to take this one?
Yes, I will. Thank you very much, Sophie, for that question. The 10 countries and head of states that were part of the He for She leaders multiplied into about more than 30 countries that have participated. In most of those countries where we have a He for She champion, we have worked on the police, making the police more gender responsive. We have created training opportunities for the police. As a matter of fact, in the last 2 weeks, we're launching a handbook that we've designed together with the law enforcement agencies that is helping to sensitize and to train and to create the manual standard procedures for dealing with crimes against women. but I cannot say that that has created dramatic reduction of violence against women. It has created more commitment, more efforts in those countries. And we are hoping in the work that we're going to be doing in generation equality, these are some of the countries that we're going to zero on. Or we've also moved in those countries when it comes to passing laws. Almost all of them have passed and adopted laws that address violence against women.
Thank you, Phumzile. I'd like to now move to Antonio Broto from FA. Can you hear me, sir?
Yes, thank you for taking my question. So I would like to have, if it's possible, some perspective on how the trends in violence against women have changed, because you have data from almost 20 years. So the numbers are stalled. Is the same percentage now than in the beginning of the century? Are there improvements in any regions? Can you tell us at least what was the percentage of women that suffer this kind of violence 20 years ago? Thank you very much.
Over to you, Claudia.
So at the moment, we do not want to compare the estimates from 2013 with these ones, because the methodology has changed and the availability of data is substantially changed, and the quality of the data is substantially changed. That's why we are referring to these as a baseline estimates so that we can track better. Having said that, we do have in our database around 30, even a little bit more than that, countries that have data for at least 2 data points in these past 18 years, and we will be looking at those trends. At the global level, we see that the figures are still within the margins of uncertainty that we had. So we're not really talking about trends at this stage. Hopefully, as countries start to do more regular data collection, we will be able to better track trends and see what is happening. I also think it's important to just flag that we need to be careful about the interpretation of trends, because as the issue becomes more acknowledged, less of a taboo issue, there is also more willingness to disclose. So we may see increases that reflect also more willingness to disclose. We need to understand the numbers in the countries in the context of what is happening also there.
Thanks very much, Claudia. I have a question from Sylvana Sale, Agency Jovem. Can you hear me?
Yes, thank you. My question moves a bit from the data you present today, but I would like to know is there any good global estimates about violence against women during the COVID-19 pandemic? And how do you assess countries' response during quarantines that we had on 2020 and now this year?
Claudia?
So these estimates precede the COVID-19 pandemic, and I think what they really bring to the fore is how widely prevalent this problem already was. The true impact of the COVID-19 pandemic on population prevalence rates will only be seen once we start to do some of these surveys again, and we look at trends, as has been said earlier. But we know from reports from countries that women have reported increased incidents, particularly women who are already in abusive relationships and where their exposure to an abusive partner was made more extreme. We know that some of the economic and social impacts of COVID also are risk factors for violence. So we have all the conditions for an increased risk, as well as at the same time a constraint in the availability of services and availability of social supports. The numbers that we have now are really from specific pockets or specific sites that have measured, and more is being published on this. But the true impact on the prevalence we will only be able to determine down the line when we start doing these kind of population-based surveys again. Maybe just to add that although COVID has brought us many terrible things and a lot of sadness, it has, if one is looking for a silver lining, it has brought attention to some issues that were previously perhaps not so much at the forefront of the attention of policymakers. And it has also brought innovation in how we deliver services, in how we reach women who are in these difficult situations, in how we provide access to supports. So, and I think it's important that we take that and build on it for the future.
Thank you so much for that, Claudia. And I have one more question from Kemi Usaya from Africa Bazaar magazine. Can you hear us, please?
Hi, can you hear me?
Yes, please go ahead.
Yeah, thank you. Thank you for taking my question. Regarding the data that the launch of the report today, my question is regarding Africa. During the November campaign, the UN Women campaign against gender-based violence, there were a lot of promises that were made. And I remember the president of Ghana mentioning that the Maputo Protocol, that there are African countries that have yet to sign on. And I guess regarding today's report, how do you plan to implement, especially address the cultural norms that encourages women to remain silent? How do you plan to address that?
Thank you for that question. Claudia, would you like to address? And then if Phumzile would like to add, we can also do that. Go ahead.
Yes, I think what I would emphasize is that prevention of violence against women really needs action at multiple levels and across different sectors and across a very wide range of actors. It's not going to be one intervention, one isolated intervention that's really going to give us a change in the population level. But as you have highlighted, the issue of changing social norms around masculinities, the issue of changing the norms around the acceptability of violence, we think is very critical. And as we said earlier, we have a broader range of interventions from community mobilization interventions to group participatory education to school-based programs challenging gender stereotypes that are addressing this. But that needs to be also coupled with laws and policies that do not perpetuate discrimination, and not just laws on violence against women, but laws around inheritance or property rights, laws around divorce or child custody, a lot of laws that impact women's ability to lead an abusive relationship, as well as interventions around economic opportunities and economic empowerment. So we really need a joined up action. And as you've said, we need the countries that haven't yet endorsed the regional protocols like the Maputo Protocol or Belém do Pará or others to join in. And we hope that this action coalition will generate a renewed energy to move countries to enact their commitments that they've already made, as well as maybe make new commitments. But I'll hand over to Phumzile, who maybe would like to say more on this.
Yes, indeed, we are intensifying the engagement of countries about their obligations to ratify the protocol. There are different levels of being close to signing the protocol. But in addition to that, because that is really a slow process from where I am standing, we are also collaborating with the AU on a continent-wide convention which they are looking at on violence against women, which is similar to the Istanbul Convention. It is under discussion, and we are hoping that this will gain momentum, especially that also the AU has joined the action coalitions. And if we do have something that is covering more countries on the continent, hopefully the uptake, even of Maputo Protocol, will benefit from that process. I also have to say we are also very distressed about sexual violence in conflict areas that we have been seeing. And so we are also urging governments to be taking action as far as that, without even having to sign a protocol, intervene because of the severity of the violence that we are seeing. Thank you.
Thank you, Phumzile and Claudia. We have one last question before we wrap up. Dr. Tedros, please go ahead.
Just wanted to add on that. I agree with Claudia and Phumzile. On the cultural norms, though, in addition to conventions, we may need to have really honest community conversations because the problem could be even at home. Sometimes when, women speak against a social norm in the society, the opposition could come from the family itself, and there could even be stigma associated with it when you do something contrary to the social norm. So, using the social tools to understand the cultural issues and having the society debate and discuss with them honestly and understand the harm on women who are facing these challenges is very important. It has already been said earlier, the consequences of violence are actually a lot. Could be depression, anxiety, and even physical harm, and you name it. So I think it should start from side-by-side community dialogue. I remember, when the age of marriage was enacted in Ethiopia, the minimum age, to fight using legal instruments to fight child marriage. And child marriage continued because parents were cooperating, because the society was taking it as it's okay. So that's it. So we need to understand that, try to address it at its root. Without the involvement of the community or appreciation by the community and understanding that it hurts their women and their girls and that they should be part of the solution, it could be difficult to address it. Even when you have a law, you can't enforce it because it's the norm. So a comprehensive approach will be very, very important, starting from prevention, and then, of course, when it happens, including law to, take action or to punish the perpetrators. Thank you.
Thank you, Dr. Tedros, for those remarks about addressing violence against women. And I'd like to also hand the floor over to Dr. Lynn-Marie Sardinia, who has an intervention.
Yes, so one of the stark findings was that intimate partner violence starts early, and like Dr. Claudia and Dr. Tedros have mentioned, it's 1 in 4 adolescent girls and young women have already experienced intimate partner violence between the ages of 15 and 19 and 15 and 24, actually. And I think this highlights the need for early interventions and prevention that starts young, whether it's school-based preventions or community-based preventions. So yes, I think early prevention is one of the things we need greater funding and focus on. Thank you.
Thank you so much for that. We have one last question for today, and it's Maria Godoy of NPR. Can you hear us, Maria?
Yes, I can hear you. Can you hear me?
Yes, please go ahead.
Thank you for taking my question. What I wanted to know is, what can this report accomplish right now? Does the world have the funds and commitment to address this issue in the midst of a global pandemic?
Could you just repeat your question for us one more time?
Yes, I'm wondering what the UN hopes that this report can accomplish at this moment. At a time when the world is in the midst of battling a global pandemic, does the world have the funds and/or commitment to address this issue at the moment?
Okay, so a question about political commitment and financial resources. So I'd like to address that to Claudia and then Phumzile, perhaps Dr. Tedros as well. Claudia?
It's a difficult question. I mean, clearly there are many competing priorities, but it's a circular situation. We know that violence, not doing anything about violence, also has costs. There has been estimates for some countries, for example, the UK, that it's between 1% and 2% of GDP. And that's just taking tangible costs like health services or legal services, or, it's not taking into account the costs in terms of human suffering and human lives. There's also the issue of continuation of this violence. We know that being exposed to violence growing up as a child also is associated with either perpetuating or being in an abusive relationship in later life. So everything has costs, but also not doing anything, not doing something about violence has also a huge cost, both human and social and economic. And I think that these numbers really need to juggle to sort of shake us up into the urgency of acting. And in some ways, I think that COVID-19 pandemic offers us an unfortunate and unwelcome, but still an opportunity. We are talking about rebuilding better. We're talking about new models, economic models that are not so much strongly based on inequality. So I think there is also an opportunity to rethink some of these social and health issues and some of the drivers of these social and health problems, and think how we can learn and do better.
Thanks, Claudia. Phumzile, would you
add something, please?
No, please go ahead.
Yes, I just wanted to say that, the reports and the data make us conscious, and it's important that the team continues to produce these. But I think we shouldn't forget that, these behaviors start at a young age, and that's where the investments must come in. If you're running a very comprehensive basic education curriculum, already in there, we must socialize boys to start respecting their own bodies and respecting the bodies of their mates or their schoolmates in class. There's a lot that communities can do on their own without looking at big resources, lots of resources that governments need to put in. We're struggling now with the downstream effects of having done nothing when we were bringing children up. It's our role as parents to socialize children, and boys and girls, in different ways. So already that's an investment. Then schools can deal with these things differently than other people in society, and parents must also take responsibility. You can't have a situation where parents say, oh, we don't do it, teachers must teach children about sexuality education. That is wrong, because we not taking responsibility for bringing up our own children. So I don't often believe that you need lots of money to deal with what is a societal issue that's about how do we deal with each other as people. And when we grew up, we knew that if we did something wrong, the father next door could beat me up or could, discipline me. So that fabric of society is broken. But there are many other things that are emerging in society at a community level that we can use to reintegrate the old values that really sustain well-being between men and women, and boys and their fathers, girls and their mothers, and communities. So there's a lot to be done. It's not just about let's get governments to give us more and more money. Why does a man beat up his partner? And why should we then give him money to do something different? And I am simplifying it, but really and truly it's about a deeply held beliefs of what the value of the people you have in your life is. So I just want to highlight that it's not only about money and reports, it's about us as a people and how we treat ourselves, others, and those we say we love. So I hope, we can learn from COVID, which has shown that women were more exposed to violence, which means they were locked up with partners who clearly didn't have respect for them and took out the anger on them. There's something wrong there. And governments can't prescribe what you do in your house. Governments can help you, but you as a partner can take responsibility for the well-being of your family. Thank you.
Thank you for those important observations, Dr. Nono. And we also have Dr. Lynn Marie who would like to add. Please go ahead.
Yes, so in relation to the COVID and funding on violence against women programs, I think this is, we have to remember that violence against women, as has been said earlier, predates COVID, and it will continue long after COVID-19, and it has generational impacts. So besides COVID shining a spotlight on this, violence against women of pandemic proportions, it also has highlighted the lack of funding and the lack of support to services for women, both response services and prevention services. And given the life course impacts of violence against women on young people, but older women as well, I think it is a priority, and COVID-19 has highlighted this. Thank you.
Thank you very much indeed. Phumzile, would you like to add anything?
In building back better, which is what we are now talking about and engaging in as part of dealing with COVID, ending gender-based violence, which we refer to as a shadow pandemic, is part of the package. So when we're talking about the resources being scarce and dealing with the reconstruction as a necessity to overcome the impact of the pandemic, gender-based violence is part of what needs to be addressed as we come out of the pandemic. And we do need to actively, including the media, lobby and make sure that gender-responsive building back better is what this is about. Because if we're going to build back better and neglect the issues that have affected women who we already say have been affected disproportionately, this will be building back badly. So it's an integral part of building back better to pick on these gender-inclined injustices that have been exposed by the pandemic. In generation equality also, we are taking on the fundraising for more work to be done on this, but we are really wanting to see that national governments also take this as part of their reconstruction, just like they'll be rebuilding back their economies, rebuilding back their digital infrastructure. Fighting for ending gender-based violence is part and parcel of that scenario. Thank you.
Thank you, Phumzile. And I'd like to come to the end of this briefing, but before I do, I'll hand the floor back to Dr. Tedros for final remarks.
Yeah, thank you. Thank you so much. Maybe instead of final remarks, I'd like to comment on the last question, and in agreement with what our colleagues said. The pandemic has actually exposed the serious problems that our world has. The level of poverty, the level of inequality, and the damage on our planet, the climate change, and violence against women. Almost all indicators were found to be worse than what we used to even think. So it has shown us that our problems are really deep. And for that, as Phumzile said, what the world is saying now is we have to build back better. And in building back better, it has to be comprehensive, meaning it should, we don't have a choice between this and that. The major challenges that we have, they have to be addressed together. So in building back better, I think this should be one of the major areas so violence could stop. And even to address this, I have said it in my speech, we need to have economic tools, we need to have educational tools, we need to have social tools, we need to have clinical tools, and also above all, there should be ownership by the whole society and treat it as such. So it will not be a choice like I think Claudia said between this and that. We need to have a comprehensive approach to address the major challenges that we have as a society. Thank you, Carla, and back to you.
Thank you, Dr. Tedros, for those remarks. So we've now had a good hour together, and we've come to the end of questions from journalists today. Let me remind you that the audio files and the remarks of the Director General will be sent after this briefing. The press release to launch this report on violence against women estimates has also been posted online at www.who.int since the embargo has now been lifted. And in that press release, you'll also find a link to the full report. If you have any other follow-up questions, please direct those to media inquiries with an I at who.int. And I'd just like to thank all of our participants, all the media who asked questions today, our speakers for today's press conference, which is now closed.